Mesdames, Mesdemoiselles et Messieurs, bonjour, bon après-midi, selon l'endroit où vous vous trouvez. Nous sommes heureux de vous savoir dès notre cours de cette session de présentation orale et je serai votre hôte pendant les 90 minutes qui vont suivre. Pour tous ceux que je n'ai pas encore eu la chance de rencontrer, je suis Suzy Limbépé et je travaille à la Fondation pour le renforcement des capacités en Afrique en tant qu'experte en lutte anti-tabac. Aujourd'hui, dans cette session, nous allons nous concentrer sur le sous-thème « Comprendre le contexte de l'usage du tabac et le développement » en mettant l'accent sur le commerce illicite, les aspects économiques de la lutte anti-tabac et l'interférence de l'industrie du tabac, entre autres. Nous aurons cette présentation dans cette session. Toutes ont été préenregistrées, mais ne vous inquiétez pas, les auteurs des différentes présentations sont connectés et seront heureux de répondre à vos questions. Nous commencerons par 4 présentations. Nous ferons une courte pause pour répondre à vos questions, puis nous poursuivrons avec les 3 autres présentations, suivies d'une autre session de questions et réponses. Vous êtes tous invités à poser vos questions en utilisant la boîte de questions-réponses ou la boîte de chat, que ce soit sur Zoom ou sur la plateforme Mova. Nous allons commencer avec Dr Arti Singh. Dr Arti Singh est médecin de santé publique et membre de la faculté de l'école de santé publique de l'Université des sciences et technologies Kwame Nkrumah au Ghana. Elle est également chargée de recherche dans le cadre du Tobacco Control Capacity Programme pour le Ghana, financé par le Global Challenge Research Fund. L'article qu'elle présentera aujourd'hui s'intitule The Sale of Illicit Cigarettes in Ghana, Finding from a Retail Survey. Écoutons Dr. Arti.
Good morning, good afternoon, everyone. So I'm Dr. Arti Singh from the School of Public Health at KNUST, Kumasi, Ghana. And my presentation is on the sale of illicit cigarettes in Ghana, which are findings from a retail survey that was conducted in Ghana. So just a bit of a background. So Ghana has a declining smoking rate and the prevalence is much higher in men as compared to women, just about 1% among women. But we still have about 5,000 people dying of tobacco-related diseases every year. But the problem currently is that there's a rise in tobacco use among the youth, especially the use of shisha, and the sale of single sticks is also quite rampant. Cigarettes continue to remain cheap and rampant despite high taxes in Ghana. And the only estimate of illicit cigarettes that we have in Ghana currently is from the Euromonitor, which accounts for about 39% of total cigarette sales. That was in 2018. Much of this has been attributed to the porous borders in Ghana and a strong demand for cheap cigarettes, particularly in the northern parts of the country. So our objectives mainly stems from the fact that there have been no prior studies on illicit cigarette market in Ghana. And the estimates on illicit tobacco share of the market are quite anecdotal and largely unknown. And the rationale for our study is that the rising tobacco epidemic, especially among the young people, and especially the unregulated tobacco sales, including the sale of cigarettes, single stick sales, is a rationale behind our finding out what the extent of illicit cigarette is, because there's been no previous studies that have really been able to identify that. So this study would be the first to really provide an independent estimate of illicit cigarette sales in Ghana. So our research questions, we have 3 main research questions. Our first one is to measure the extent of illicit cigarette consumption in Ghana using the MTPAC survey method, and then also to determine the nature and the types of illicit cigarettes in Ghana. We also want to compare the differences in the illicit trade market across the different geographical locations within the country, including border and non-border towns. Our methodology included the use of 2 main types of surveys, which included an empty pack survey where we went ahead to collect empty packs from retailers selling these cigarettes, and then the retailer survey itself, where we actually interviewed the retailers selling these cigarettes. And our sampling strategy was quite representative, as we tried to get the locations within the 3 geographical zones of the country. So in the upper zone, we had about 3-4 cities and towns. In the lower, in the coastal zones, we had the same numbers, and in the middle belt as well. So we tried to cover the entire zones of the country. And most of our cigarette packs that we collected belonged to drinking bars, which accounted for 58.6%. And majority of our packs, which is almost about half of them, were from the coastal zones. That's where the capital city of Ghana is, Accra. And about 1,164 of these packs, which is close to almost about a third, originated from Accra, which is the capital city of Ghana. And about 16%, which is slightly more than 1 in 10 of them, were from border towns. So our results for this study was that from the pack survey, what we realized that we collected a total of 4,461 packs that were collected from a total of 384 retailers. And one striking finding was that single sticks was sold by 100% of our retailers, and about 20.7% were classified as illicit. The classification of illicit was based on what the Food and Drugs Authority has in place. So the absence or presence of a tax stamp, the country of origin not being Ghana, does not have a for sale in Ghana sign, and there's no presence of a warning label, either pictorial or textual. And about 30% of our retailers were selling these illicit packs. So in terms of our illicit tobacco, that the cigarettes that were being sold, about 20% were illicit from all the total number of collected. Majority of these packs originated from the coastal towns that included Accra, and about half of them were from the border towns. And a third of them were from Tamale, which is at the northern border of the northern zone of the country, and Aflao, which accounted for about 46.9%, which is the border town between Ghana and Togo. And the country of origin of these packs, the majority of them were from Togo, which is about 50%, and the rest of them were from Nigeria, from Niger, and about 10% of these packs were from Cote d'Ivoire.
You know,
and our packs, the pricing of these packs, these illicit packs were found to be in the lowest price category of pricing of packs per stick, the stick sales and per pack sales. So all these packs were among the lowest category of pricing. And from our retailer survey, what we identified was that cigarettes was the most common product that was sold. Over 90% of them were selling cigarettes. And about half of our retailers knew what illicit tobacco products were, but about half of them also didn't know about it. And about a third of them did not know about any law that regulates the sale of tobacco in the country. And about 70%, which is more than 2/3 of them, did not have their shops that were visited by any inspector or official. So our key study findings illustrates that 1 in 5 cigarette packs sold in Ghana is illicit. The sale of single sticks is quite rampant, and close to half of illicit tobacco products originates from Togo, followed by Nigeria. And about half of our retailers are not aware of what illicit tobacco is, and a third of them are not aware of these laws that control illicit tobacco products. So our recommendations are basically that we really need larger studies to be able to identify the true extent of illicit cigarette sale in the country. We also need a country-specific tracking and tracing system that is independent of any industry interference. We also need to ratify the illicit tobacco protocol that Ghana is actually in the process and hopefully should get ratified pretty soon. And we also need implementation and enforcement of this protocol once it comes into force. Civil society organizations should continue to strengthen their efforts when it comes to monitoring tobacco industry. We also need educational campaigns for the youth and the retailers to be able to understand what illicit cigarettes are and the harmful nature of these products. One limitation of our study would be that it would have been, due to COVID, we were not able to explore most of these border towns that are present throughout the country, and we were only able to go to specific ones. And due to COVID, we had some restrictions in the number of towns that we could collect our packs from. So I thank you for listening to me, and I would like to thank the Tobacco Control Capacity Program, School of Public Health at KNUST, Professor Ellis Osudabo, he's the principal investigator of this study, Hannah Ross from University of Cape Town, University of Bath in the UK, our research assistants and our project manager for getting us through this project successfully. Thank you very much.
Merci beaucoup, Dr. Arti. Nous retenons de cette présentation que la vente des cigarettes au détail est un véritable défi et que la ratification du protocole et sa mise en œuvre sont également très, très importants si nous voulons combattre le commerce illicite des produits du tabac. Nous allons continuer à parler du commerce illicite des produits du tabac. Et nous allons, avec la prochaine présentation, aller en Éthiopie. La présence d'un commerce illicite de cigarettes est utilisée comme un argument par l'industrie du tabac en Éthiopie pour freiner les politiques de taxation du tabac favorables à la santé. L'étude menée par Campaign for Tobacco Free Kids et d'autres partenaires sur le commerce illicite de cigarettes en Éthiopie est l'objet de notre prochaine présentation et nous permettra d'avoir une meilleure compréhension de la situation réelle. Écoutons ce que Estelle Doshi, économiste et chercheur à CTFK, va nous dire dans sa présentation.
Hi, and welcome to the ADCA, the first ADCA. Today I'm going to present a paper where we estimate the size of the illicit cigarette market in Ethiopia. This research has been made in collaboration between the Campaign for Tobacco Free Kids, where I work, the CORDE group, the Consortium of Research and Development in Ethiopia, and the RIP at the University of Cape Town. Why is this research important? This research is important because the tobacco industry has been using illicit trade as a weapon to block tax progress in Ethiopia as well as in many countries. In many countries, the tobacco industry, in fact, exaggerates and provides false claims about the impact of increasing taxes on revenue, claiming that it increases smuggling and therefore limits tobacco revenue collections. And therefore, it has led several countries to underutilize tobacco taxes as an effective policy tool to prevent tobacco use. In particular, the National Tobacco Enterprise, which has been a monopoly in Ethiopia for several years and now is owned by JTI, has claimed that the size of the illicit market in Ethiopia for cigarettes is around 61%. So how do we do this illicit trade study in Ethiopia? We do actually two cross sections starting in 2018 when we collected the data. We collected data directly from retailers, empty packs collected from retailers in 10 towns, which were purposely selected throughout the country to cover all parts of the country, 9 regions and states, and 2 autonomous cities, including Addis Ababa and Addis Ababa. We also collected empty packs from the streets using the same random selection from discarded packs. And then the packs were carefully examined for whether they were illicit or not. The situation on the field was not easy during this data collection because of political situations and people and our surveyors confronted by people with guns, etc., road blockages. So the data collection actually took a little more than a year. Several criteria for whether a pack is illicit or not. Those criteria vary from country to country. In Ethiopia, they are also different from other countries. In particular, in Ethiopia, there is no tax stamp, so there is no way to actually identify whether a pack has paid the excise tax or not. However, we can assess whether a pack is licit or not by looking at both tax and non-tax dimensions. Among the non-tax dimensions, all packs should have a health warning label, and the health warning label should be in accordance with the law. Then all packs should have the country of origin written on the pack, knowing that only 2 foreign brands are allowed to be distributed in Ethiopia. And those are Rothmans and Marlboro. And also flavored brands like Green Apple or Strawberry are illegal. No flavored brands is legal. There should be also a statement that the brand could be sold in Ethiopia on all packs, and of course duty-free packs are not allowed in Ethiopia. So those are the 4 main criteria. Those are examples of licit or illicit brands. Most licit brands collected turned out to be domestic. Those include Niala, Delight, Gisela, Rothmans, which is a foreign brand. And in total, we collected 30 brands. So as you can see, most of the brands were actually illicit. The findings was that the total share of the illicit market in Ethiopia, based on our surveys, or 2 surveys, is about 18.9% of the total market. But an important finding is that most of this illicit market is concentrated in the east of Ethiopia, towards the border with Somalia and Somaliland. As you can see, although the overall country average is 18.9% of the market. The share of illicit cigarettes in the East is much larger, above 90% in Jijiga and above 80% in Dayadawa. But in all other regions, North, West, South, and Center, it's less than 10% and even less than 5%. The previous results that I just showed here are non-weighted. They are, as I mentioned, it's a random selection, but the locations were conveniently selected. They are not representative of the country. So we cannot just say using at least 18.9% that it's representative of the country as a whole. But we furthered that study by linking the data to a nationally representative survey data, which is the HIS, provided by the Government Statistics Bureau. And we reweighted the illicit trade study using consumer level expenditures and find that the weighted average size of the illicit market is closer to actually 45% of the market. This number is larger, it's like twice larger than the unweighted number, but it's still much smaller than the number proposed by the industry of 61%. In discussion, it's important. This result is important because recently the Ethiopia has passed the largest landmark tax legislation in Ethiopia. It has significantly changed the way cigarettes are taxed in the country, changing the ad valorem from 75% of the cost of production to 30% of the cost of the retail sales price, which is a much better type of ad valorem. And for the first time, it also included a specific excise of 8 birr per pack. This reform has significantly increased the tax share in the price, and it has been a significant progress for Ethiopia to fight tobacco use. But soon after, the NTE, the tobacco industry, produced its new estimate of 61% of the market. So we still need to be vigilant, and tobacco control advocates need to be vigilant and keep developing this type of research to counter industry's argument. In conclusions, Ethiopia needs to also strengthen its border security and introduce tax stamps in order to better control for illicit trade. It's important to know that even if most countries that have an illicit market use excise taxes to reduce tobacco use, it's still possible to use excise taxes to reduce tobacco use, even in the presence of illicit trade. So the illicit trade has nothing to do with how taxes affect tobacco use. But it's important for Ethiopia in the future to still introduce tax stamps and more border security, hopefully a track and trace system, as many other African countries have done, including Kenya, Tanzania, Chad, Togo, and other countries. If you have more questions about this research, you can contact me directly, or you can also look at our website on Campaign for Tobacco Free Kids, where the full report, including the data, are located. And again, you can also contact me to ask me more information about the report. Thank you very much and enjoy the rest of the conference.
Merci beaucoup, Estelle. De cette autre présentation, nous retenons que l'augmentation des taxes sur les produits du tabac n'est pas la base du commerce illicite. Cela a été longuement discuté dans la session précédente. Il est important pour les pays de mettre en place bon nombre de mesures, incluant plus de sécurité au niveau des frontières et des dispositifs de suivi et de traçabilité, afin d'assurer ou bien afin de réguler le commerce illicite des produits du tabac. Il est également important que nous puissions conduire plus de recherches pour mettre à disposition des gouvernements des données fiables afin qu'ils ne puissent pas s'appuyer sur les données biaisées que donne l'industrie du tabac. Nous allons passer à la prochaine présentation et nous savons à quel point la mobilisation des ressources nationales est importante pour nos pays. Nous n'avons cessé de souligner depuis le début de cette conférence que pour une lutte anti-tabac efficace, nous devons accroître les ressources nationales. L'article qui nous sera présenté dans un instant est une étude de cas portant sur les stratégies utilisées par l'industrie du tabac pour saper la mobilisation des ressources au niveau des pays. Notre présentateur est le Dr Boaz Munga. Il est chercheur au Kenya Institute for Public Policy Research and Analysis, KIPRA, depuis plus de 12 ans. Et Dr Munga a participé à des recherches axées sur les politiques dans de nombreux domaines, dont la lutte anti-tabac. Écoutons Dr Munga.
Greetings, fellow participants, to this first Africa Conference for Tobacco Control and Development. My name is Boaz Munga, and I'm going to present a paper, Tobacco Industry Strategies to Undermine Domestic Resource Mobilization, which is a case study of 4 countries in Africa: Democratic Republic of Congo, Kenya, Nigeria, and Zambia. This paper was commissioned and funded by the Tax Justice Network Africa. By way of introduction, we shall cover through the introduction, objectives, methods, key findings, importance of the study, and its limitations. Evidence indicates that illicit financial flows, including corporate tax avoidance, to be a significant challenge facing many African countries. Despite this, research on tobacco control has mainly focused on tobacco taxes borne by consumers, that is excise taxes, and hardly any focus on corporate taxes. So this study recognizes that African countries need to measure, track, and hold tax avoidance. The broad objective is to examine illicit financial flows in the tobacco sector due to tax avoidance and evasion in these 4 case study countries. The specific objectives are to provide estimates of losses in corporate tax avoidance resulting from tax avoidance, and review the institutional frameworks that facilitate tax avoidance, and lastly, to document experiences in different jurisdictions for lessons we can learn. For purposes of this presentation, we shall mainly focus on the first specific objective. Our conceptual framework is presented in this slide, and it tries to provide the components of these strategies to undermine domestic resource mobilization. There are 2 broad components: tax avoidance on the one hand and tax evasion on the other. We shall mainly focus on tax avoidance, and tax avoidance again has 4 main components. Transfer mispricing is the first one, base erosion and profit shifting, centralized procurement, and self-lending by multinational corporations. The paper has some notes on tax evasion too. Those are not covered in this presentation. What are the methods? To measure tax avoidance, the study relied on estimates of losses as a percentage of GDP reported in other studies of countries with similar characteristics as the 4 case study countries. An example of a study we used was a comparative study by Cobham and Jansky, 2018, that estimated tax revenue loss as a share of GDP due to base erosion and profit shifting. This study actually provided percentage losses for upper middle, lower middle, and low income nations. Using these percentage losses, we were able to estimate the respective tax revenue loss in each of the countries we were interested in. And subsequently, we were also able to estimate the loss attributable to tobacco multinationals by trying to come up with an estimate of the size of the tobacco multinationals with respect to other multinationals in the respective countries. What are the key findings? We capture this in table 1, and in table 1, in the column to your left, we see the components of tax avoidance. And the last table gives us the share of GDP that is lost to this tax avoidance. And what do we notice? We notice that countries lose between 1.8%, that is the DRC, to 5.2% for Kenya as a share of GDP to tax avoidance. You notice also, if you look at the middle of that table, some components such as debt shifting has had very few data available, and we're only able to estimate it for Kenya, which loses $11.9 million in 2019 due to debt shifting. We reviewed literature and on policy, legal, and institutional frameworks that facilitate tax avoidance, and some of these include inadequate clarity in regulations, absence of penalties, and enforcement challenges faced in these countries. There are others like skewed agreements or treaties on double taxation. Why is this study important? This study is important following the problem of tax avoidance and the tobacco industry has remained profitable, while undermining domestic resource mobilization in these poorer countries. This challenge also undermines raising of adequate tax revenues to combat the negative impacts of tobacco and combat development challenges such as poverty. Then the other issue that comes into play is that global and national strategies have placed less emphasis on tobacco industry corporate taxes. And in addition, the global architecture, the global rules and regulations are loopholes that have resulted in corporate tax avoidance. A major limitation of this study is limited data and information on important aspects such as self-lending and procurement, and this resulted in what we can call partial estimates of corporate tax avoidance. It gives us a way forward, which is more research in this area to inform policy decisions. Thank you, fellow participants, for your attention.
Merci beaucoup, Dr Munga. Nous retenons que l'industrie du tabac utilise l'évasion fiscale afin d'éviter de payer les taxes au niveau des différents pays où elle opère, alors que ces taxes sont des sources de revenus pour les pays. Nous allons passer à la dernière présentation de cette série. Je vous rappelle que vous pouvez poster vos questions dans la boîte Q&A si vous en avez, et nous pourrons les poser aux différents panélistes lors de la courte session de questions-réponses que nous allons avoir après la prochaine présentation. Et vous le savez, il existe plusieurs façons d'évaluer l'ampleur du commerce illicite des cigarettes. En Afrique du Sud, différentes méthodes ont été utilisées. Et Nicole Velios en a fait une étude de cas. L'objectif de l'article qu'elle va nous présenter est d'aider les chercheurs à décider quelle méthode est la plus adaptée à leur contexte, en particulier pour les pays ne disposant pas d'éléments de sécurité sur les paquets de cigarettes, comme par exemple les timbres fiscaux. Nicole est chargée de recherche à RIP. RIP, c'est the Research Unit on Economics of Excisable Products. Ils sont basés à l'Université du Cap. Et ces recherches actuelles portent entre autres sur le commerce illicite des produits du tabac. Je crois que c'est une session très importante et que vous allez prendre du plaisir à écouter sa présentation. Écoutons ce que Nicole va nous dire.
Good afternoon, everyone. My name is Nicole. I work for the research unit on the economics of accessible products at the University of Cape Town. Today, I'll be presenting on some research we did last year. We consolidated a few papers we wrote on illicit trade and reported on disadvantages, advantages, some tips that researchers thinking about looking at illicit trade can use in their own countries. The title of the paper is Measuring the Illicit Cigarette Market in the Absence of Pack Security Features, a case study of South Africa. There are several ways to measure the illicit cigarette markets. In South Africa, two methods were used: gap analysis and price threshold. We used both primary and secondary data. These methods are useful for countries that do not have security features on cigarette packs, for example, tax stamps. Gap analysis compares self-reported consumption estimates from national survey data with legal sales as declared to the Excise Tax Authority. To calculate self-reported consumption, data is required on smoking prevalence and smoking intensity. Tax-paid cigarette sales data was sourced from national government. This graph shows illicit trade from 2002 to 2017. This is using the All Media and Products survey. Using the gap analysis method, we found that between 30 and 35% of the total market in 2017 was illicit, and that the problem had been escalating since around 2010. There are several advantages to using the gap analysis method. It's transparent, replicable, nationally representative, relatively inexpensive because one uses existing data, and it can be updated each year if surveys are done annually. There are several disadvantages. The results are sensitive to underreporting assumptions. requires government data on excise paid cigarettes, which may not exist or may not be publicly available. One cannot distinguish between tax avoidance and tax evasion. It relies on self-reported data, which is often very inaccurate. And the presence of roll your own cigarettes might not be included in the official statistics, but are reported as cigarette consumption in surveys. Just some practical tips: investigate existing data as variables on smoking may exist. Ensure imported cigarettes are accounted for in tax paid cigarette sales data from government sources. The price threshold method distinguishes illicit cigarettes from illicit cigarettes by defining a threshold price below which it is impossible to sell the product at even a modest profit and cover taxes and production costs. As an example, in 2018, we estimated that the threshold price was 20 Rand, and this was based on a summation of the excise tax, VAT on excise, manufacturing costs, and VAT on manufacturing costs. We had no information on distribution costs and profits, so this threshold price is very conservative. The advantages of using this method when you are collecting, when you're using existing data, is that it's inexpensive. Again, it relies on self-reported data, which can be inaccurate, and they might be sensitive to the choice of the price threshold. And to account for this, it's advisable to use different levels as a sensitivity analysis. Investigate what national surveys are planned for the coming years and request the addition of questions if they are not in existing surveys. When collecting data from smokers, researchers can target specific demographic and socioeconomic groups. It can be expensive. In our case, the first round of data was about 250,000, about $20,000 US, and that was for 1,200 smokers, so quite a small sample. If you are in areas with high crime, the enumerators may be exposed to dangerous situations. It takes a lot of time to get through ethics, and respondents may think that field workers are linked to the police and may not declare the true price that they paid. If weights are not applied, the sample will not be representative. It's advisable to state in the information sheet before starting the survey that you're not linked to the police, and using a survey company with local knowledge and experience is also extremely helpful. So from the 3 different papers that use 2 different methods, we estimated that illicit trade was between 20 to 35%. While there are several methods available to researchers to measure illicit trade, the choice is country specific. Researchers need to understand the regulatory environment, for example, cigarette packaging laws, and investigate available data sources. Results obtained from using several methods allows a level of confidence in the results that would be lacking if only one method is used. Thank you for listening, and please be in contact if you have any questions.
Merci beaucoup, Nicole, pour ces orientations très importantes. Et ces conseils qui peuvent stimuler plus d'un à entreprendre des études sur le commerce illicite des produits du tabac au niveau des différents pays. Pour tous ceux qui participent à cette session, vous pouvez entrer en contact avec Nicole si vous voulez avoir plus d'informations ou si vous souhaitez poursuivre cette discussion. Je vais inviter Dr Arti et Dr Munga à revenir sur ce que je peux appeler sur scène pour répondre à 1 ou 2 questions. Les participants sont toujours invités à poster leurs questions, mais en attendant, je vais demander à Dr Arti, le Ghana vient tout juste de ratifier le protocole sur le commerce illicite des produits du tabac, et vous avez donné comme recommandation à la fin de votre recherche la ratification de ce protocole. Mais nous pensons que les recherches que vous avez entreprises et les résultats que vous avez partagés avec nous ce jour restent d'actualité et sont très importantes. Ma question aux deux chercheurs, que sont Dr. Arti et Dr. Munga, est de savoir la question de la disponibilité des données pour les activités de plaidoyer a été souligné comme un défi majeur par nombre de participants au courant de cette conférence. Et j'aimerais savoir quelles sont les stratégies de dissémination de votre recherche que vous utilisez afin de vous assurer que les informations importantes qui peuvent aider à informer la formulation des politiques au niveau des pays, que ces informations soient mises à disposition peut-être pas du grand public, mais des activistes qui en ont besoin, des acteurs de la lutte anti-tabac qui cherchent à avoir ces données désespérément pour pouvoir construire leur message de plaidoyer. Quelles sont vos stratégies de dissémination de recherche? Peut-être nous allons commencer avec Dr. Arti.
Thank you, Susie, and good morning, good afternoon, everyone. So yes, since we did this study, this was somewhere, we completed everything somewhere around March, April, and we are now currently in the writing phase. So hopefully we'll be publishing it very soon. So that way, I guess the larger tobacco community could also have access to the information and the recommendations that we have. And we've also made our data available to the Food and Drugs Authority in Ghana, which really would be the one to see to it that the illicit trade market is handled the way it should in terms of getting tighter border controls, getting these tax stamps in place, and then so the Food and Drugs Authority is actually the focal point of tobacco control in Ghana. So, and they are in the know of this study and the findings. So we are in close collaboration with them. So that's one of the ways we are trying to get our findings across to them. And luckily for us, the illicit tobacco trade protocol has just been ratified. And this was just around the time that we presented our findings. So I think our findings have also had some impact in the full ratification of the protocol. Thank you.
Merci beaucoup, Dr. Arti. Peut-être une question pour suivre, pour continuer dans la lancée de ce que vous avez dit avant de retourner vers Dr. Munga. Vous avez souligné la vente des cigarettes au détail comme un vrai défi lorsque vous avez conduit votre étude. En l'état actuel, y a-t-il des dispositions dans la loi au Ghana qui peuvent permettre de répondre ou bien de combattre ce qu'on pourrait appeler ce fléau. Et il est assez commun à de nombreux pays, je crois, en Afrique. Nous avons cette vente très courante des cigarettes au détail, qui est un véritable fléau. Comment est-ce que nous pouvons, du point de vue de la recherche, avez-vous des pistes de solutions pour y remédier?
Yes, so I think from what we have done, we did a PAC survey. So, and this is one of the methods that we would use if we have the sale of single sticks as the most prominent thing going on in our country. So because of the fact that they have single sticks being sold, we were able to conduct this kind of survey. But I think if we conducted a bit more larger studies where we would have maybe a larger sample size, our restrictions were mainly due to COVID, where we could not explore many other areas. But if we didn't have COVID in the picture, we probably could have done a much more bigger study, and maybe our findings would be a bit more generalizable. And of course, in terms of sample size, we will be able to say something more solid than what we have. But of course, we've been able to conclude that 1 out of 5 are illicit cigarettes in Ghana. So that really tells us that we do have a problem. And so I think that we need more bigger studies that should be conducted around illicit tobacco to find maybe a bit more of a true extent of the problem.
Merci, Dr. Arti. Dr. Munga, pour revenir à vous, on va commencer avec la première question qui a été posée tantôt. Quelles sont vos stratégies de dissémination des résultats de votre étude afin de vous assurer que les acteurs de lutte anti-tabac ont accès aux informations importantes que vous nous avez partagées aujourd'hui?
Okay, thank you. Maybe to have a comment on that, I can say I work in a research institution, and data becomes very important to us. Data that can be shared. So the major strategy we have, one of the strategies we have employed is to use memorandum of understanding between us and the key stakeholders. So if I may give an example, we have a memorandum of understanding between our institution and the Kenya Revenue Authority, which is useful that when you want to, for instance, get even production estimates of tobacco and even the excise taxes over time. So with this MOU, it becomes easier for us to access the data. I imagine your question sounded like what we do as to ensure that data is available to others. If it is in that context, then we believe in sharing our findings, and we are open to others to also receive our data. And in sharing our findings, we have many forums, including short publications and policy briefs. I think that is how I'd want to answer that question. Thank you.
D'accord. Merci beaucoup, Dr. Munga. Nous allons vous garder et passer à la prochaine session de présentation, et nous continuerons à suivre la boîte des questions pour voir si nous avons de nouvelles questions qui sont posées aux panélistes. Nous allons continuer maintenant avec Kirsten. Elle est chargée de recherche à RIP à l'Université du Cap. Elle a une expérience de recherche en économie de développement avec un accent sur l'économie du travail, les salaires minimums et l'analyse de la pauvreté et des inégalités. Sa recherche actuelle porte sur la collecte de données sur le prix des cigarettes en Afrique et sur la politique de taxation du tabac en Afrique du Sud. Kirsten présentera 2 articles. Nous allons commencer avec le premier, qui a pour titre « When cigarette sales suddenly become illegal. Evidence from an online survey of South African smokers during COVID-19 lockdown ». Comme nous le savons tous, l'Afrique du Sud a interdit la vente des cigarettes pendant le confinement suite à la pandémie du COVID-19. Et cette recherche montre comment l'interdiction a affecté le marché des cigarettes pour un échantillon des fumeurs. Je crois que nous allons en savoir plus en écoutant la présentation de Kirsten.
There. My name is Kirsten van der Zee, and I'm going to be presenting a research paper that myself and 2 colleagues did on the tobacco sales ban that happened in South Africa in 2020. So we are from a research unit called the Research Unit on the Economics of Excisable Products. We're based in the University of Cape Town in South Africa, and we focus primarily on economics of tobacco. So tobacco taxation, illicit trade in tobacco, etc. We do some work in other products such as alcohol, sugar sweetened beverages, and occasionally cannabis, but our primary work is in tobacco. So the focus of the research paper today is on in 2020, as was happening around the world, our president announced in March that there would be a lockdown coming into place. And one of the unique elements of the South African lockdown was that they placed a ban on the sale of tobacco products. There was a comprehensive ban. All tobacco products could not be sold during the ban. The expectation initially was that this ban would last for only 3 weeks. However, there were multiple extensions of the ban, and it was eventually only lifted after 20 weeks. For some context, smoking prevalence in South Africa is about 20%, so it is still quite prevalent. That's smoking of cigarettes amongst adults. And illicit trade was quite a significant problem before the ban was put in place. So it was estimated in 2019 to be between 30 and 35% of the total cigarette market. So being tobacco control economists, when we found out about this very unique policy, we decided to put together a questionnaire of smokers during the ban. In the end, we ran two surveys of smokers during the ban and one a few weeks after the ban was lifted. And I'm going to be discussing a research paper that's currently under review at the journal Nicotine and Tobacco Research. And the main focus of this paper was on the market dynamics. So what was happening in the cigarette market? Were smokers continuing to buy cigarettes? And if so, how were they doing it? And what were they buying? And how much were they spending? So to jump straight into the findings of our paper, a key finding was that smokers in our sample were the vast majority of them were continuing to buy cigarettes despite the ban, and they were paying significantly higher prices than they were paying before the ban. So as you can see, in June, which was during the ban, they were paying about R5.70 for a stick, compared to R1.67 that they were paying before the ban. So this is about a 240% increase in price between the pre-ban and ban period. In the post-ban period, as you can see, prices did reduce again, but they were still higher than their pre-ban levels. One of the very interesting findings of our paper had to do with the market composition. So in South Africa, as you can see, before the ban happened, the blue represents the multinational companies. So we asked smokers what brands did you buy, and then we allocated those to either multinational companies like British American Tobacco or to the local producers. So before the ban, about 77% of the market in our sample represented multinational brands, and only about 22% of them represented local brands. And for context, research did show that the local producers were selling the bulk of the illicit cigarettes that were available on the market. So very interestingly, in June, during the lockdown, the market composition had turned completely on its head. Multinationals were only selling about 23% of the brands in our sample, and 75% of the brands in our sample represented local or regional producers. And strikingly, even a few weeks after the ban was lifted, this change in composition was still evident. So multinationals had recovered a lot of their pre-ban market, but they'd still lost about 17% of their market, of the market that they had before the ban. So they were selling at about 64% of brand sales, whereas locals had about 33% of brands of sales, compared to 22% before the ban was in place. We then ran a regression, which spoke to what are the covariates of price before, during, and after the ban. So what are the things that contributed to higher prices in those 3 periods? This analysis was much more comprehensive, but I've just pulled out a few of the interesting findings. So first, you can see this is the difference between multinational and local producers. So in the pre-ban period and in the post-ban period, you can see that multinational products were priced significantly higher than non-multinationals. And while this was still the case during the ban, local producers had increased their prices actually by relatively more than the increase in the multinational prices. So the difference in price between multinationals and locals had reduced. Another interesting finding related to the regional differences in prices. So part of the lockdown was that people couldn't move provincially. And you can see the effect that it had on the market. So in the pre-ban period, the province that you stayed in generally didn't impact how much you paid for your cigarettes. However, during the ban, there were significant differences in the prices of cigarettes across the different provinces. So this probably suggests that where you were really impacted on what you were able to buy, how much you could negotiate for your brand, what brands you had available to you, etc. And these provincial differences were gone again in the post-ban period. So this was a very interesting study because only 3 countries in the world implemented a sales ban as part of their COVID-19 response. Our data set really gave us a novel view of what happened during the ban, and it showed us that cigarettes were still readily available, albeit at very inflated prices, and that there was a big shift in the market composition during the ban. Lastly, we did have some limitations of the study, so it wasn't representative, and we don't claim that it was representative of all smokers. However, recently a nationally representative study has come out that did look at some aspects of smoking during the ban, and their findings do correspond to a lot of our findings, so it does give us confidence in our study. So for more information, you can contact me. Hopefully that paper will be available publicly very soon, and then you can look in more detail at our findings.
Merci beaucoup, Kirsten, pour cette première présentation. Dans la seconde, nous savons que dans de nombreux pays, le commerce illicite des produits du tabac constitue une menace majeure pour l'effectivité des politiques de lutte anti-tabac et la santé publique. Le suivi et la traçabilité font référence à des systèmes sophistiqués dans lesquels les produits sont marqués d'un identifiant sécurisé et non reproductible, permettant de remonter à l'origine de la fabrication des produits et de les suivre le long du canal de distribution. Le protocole pour éliminer le commerce illicite des produits du tabac exige que les parties mettent en œuvre un système de suivi et traçabilité indépendant. Le deuxième article que va nous présenter Kirsten et qui s'intitule Track and Trace Break-Even Simulation Model éclairera sûrement notre lanterne et nous permettra de mieux comprendre ce que c'est, ce que cela implique pour tous les pays qui sont déjà en train de ratifier le protocole. Nous l'avons suivi hier, la région Afro est en tête avec le nombre de parties au protocole et il serait important après la ratification que nous puissions passer à la mise en œuvre. Donc, écoutons cette autre présentation de Kirsten.
Hi there, my name is Kirsten van der Zee, and today I'm going to be presenting a piece of work that myself and my colleague, Dr. Hannah Ross, are working on called the Track and Trace Break-Even Simulation Model. For some background, we are from the Research Unit on the Economics of Excisable Products based at UCT in Cape Town. We're an accredited research unit since 2019, but we've been working in tobacco control economics for many years before that. Some other areas of research that we work in are alcohol, sugar-sweetened beverages, and occasionally on cannabis, but our primary work is in tobacco control economics, mostly working on taxation and illicit trade and those sorts of topics. Now, the background for today's paper is that we know that illicit trade in tobacco products is often a major threat to the effectiveness of tobacco control policies and just a general threat to public health. So one of the major remedial actions we can take against illicit trade is track and trace. So track and trace system is the implementation of a sophisticated basically tax stamp system where products are marked with a secure identifying barcode, which allows a product to be traced to its original manufacturing origin, as well as tracked throughout the distribution chain. The protocol to eliminate illicit trades in tobacco products requires that parties implement an independent track and trace system. So governments are thinking very hard about how to implement systems like these. A major challenge that governments face with implementing track and trace is that while track and trace brings illicit products into the legal market and allows them to be taxed, So it generates additional revenue. At the same time, it also costs money to implement. These are highly sophisticated systems and can be expensive. So we have developed an Excel-based model that helps government find the tax stamp price that will allow them to break even when implementing track and trace. In other words, the additional revenue that they're getting from the addition to the legal market and to taxable tobacco products, where that amount is equal to the total cost that they're going to be spending on track and trace. The model is based on very basic economic principles and can be tailored to any specific country context. So the model works on a three-step process. The first part of the process is to set up the baseline scenario. So this is setting up what does the tobacco landscape look like in before track and trace has been implemented, or the current existing market. You need a bit of data to set up this system. So firstly, you need estimates of the legal and illegal cigarette market, the size of the markets. You also need an estimate. You also need to know what does the tax structure look like for tobacco products? What is the market composition? Are there many different brands, many different price points? And what does the price structure look like? How much of it is going to tax? How much is going to the tobacco industry, etc. Besides this, at this stage, we also need to implement a few, or we need to include a few key assumptions. The first and possibly most important one of those is the price and cross-price elasticity of demand for cigarettes. So this is a concept that economists talk about quite a lot, and it's the relationship between a price change and a consumption change. So for example, if I increase the price of cigarettes by 1%, by how much is consumption going to decrease? As we know, if the price of a product goes up, of a normal product goes up, demand for that product is going to go down. So we need an estimate, or we need to assume the magnitude of this shift. We also need to make an assumption on how effective the track and trace system will be. So a system that is 80% effective, that gets 80% of the illicit market into the legal market, is going to be very different to a track and trace system that's only 30% effective. We also need to make an assumption about how the industry is going to respond to the track and trace being implemented. The second step is to simulate the implementation of the track and trace policy. So that means that prices are probably going to change. They're probably going to go up as the industry responds. And a lot of the illegal market is going to shift into the legal market. And that's going to depend on things like how effective track and trace is. The third and final step is the optimization point. So this is where we use Excel's goal seek function. It's a pre-programmed function in Excel that basically works out what is the addition to revenue, the additional revenue from implementing the track and trace system, and what is the total cost of the track and trace system. And let's make those two things equal to each other by changing the tax stamp price. And that'll give us the optimal, the tax stamp price that allows governments to break even. And so governments will know if the price is any higher than that, they may be making a loss on their track and trace system. If it's any lower than that, they may be making a net revenue gain. Where are we at currently with this project? We are still refining the model, and we hope, although we're in the finishing stages of that, but we hope to submit it to a journal very soon for publication. And thereafter, we hope that it will be available to be tailored to various country contexts. Some limitations of this model is that there are a lot of data that's required to let the model work, and that the model is only as good as the assumptions. So we need to be sure that we've got strong data and assumptions backing it up, and that we do some scenario testing. The implications. This model will provide a very usable tool to just empower governments when they're busy negotiating prices for track and trace systems, and it will really help them understand the benefit of implementing a track and trace system. We can see what happens. We get estimates of what might happen to illicit trade, etc. So it's a very usable, simple tool that will really be able to enable governments when they're implementing track and trace. So there are my contact details if you want to hear any more about this project, but I hope that it was helpful.
Merci beaucoup, Kirsten. J'espère que tout le monde peut m'écouter. Je crois que j'ai été coupée pendant un court instant. Nous allons continuer. Je crois que cette présentation était très importante, surtout dans notre région où nous sommes en train d'évoluer après la ratification du protocole et que nous évoluons vers la mise en œuvre. C'est une présentation très importante et je crois que RIP restera disponible pour apporter son appui aux différents participants qui voudraient bien discuter de ce sujet plus en profondeur ou bien là où les nécessités de renforcement des capacités, que ce soit au niveau des gouvernements ou de la société civile, se font sentir. Nous avons dans cette session commencé avec des présentations qui ont évalué l'importance ou l'ampleur du commerce illicite dans certains pays. Nous avons eu des résultats importants et parfois des résultats importants, je peux dire. Nous avons continué en voyant les différentes méthodes qui pouvaient être utilisées afin d'évaluer le commerce illicite des produits du tabac. Nous avons continué avec les présentations qui viennent d'être faites en voyant comment est-ce qu'en mettant en place un système de suivi et de traçabilité, on pouvait juguler le problème du commerce illicite des produits du tabac. Nous allons continuer maintenant sur un tout autre aspect. Nous savons que la taxation du tabac ou des produits du tabac est citée et a été discutée tout au long de cette conférence comme l'un des outils les plus efficaces disponibles pour freiner la consommation du tabac, surtout au niveau de la population jeune. Toutefois, là, on a pu observer que parfois, malgré les augmentations de taxes sur le tabac, certains fumeurs pauvres continuent néanmoins de fumer. Et la question que l'on pourrait se poser serait de savoir quel impact est-ce que cela peut avoir sur les dépenses du ménage. Nous en saurons plus après avoir écouté la prochaine présentation qui sera faite par Zonda. Zonda est économiste de la santé et Zonda Chicha, il possède une expérience avérée dans le domaine de la santé publique, de la mise en œuvre des programmes de recherche et il a cumulé plus de 10 ans d'expérience dans le cadre de projets de recherche universitaire en Afrique subsaharienne. Zonda est actuellement chargé de recherche à l'unité de recherche de l'Université du Cap. Et il va nous faire sa présentation sur l'impact que peut avoir l'augmentation des taxes sur les produits du tabac peut avoir sur les dépenses des ménages là où on consomme les produits du tabac. Zonda.
Opportunity to present my research titled The Household Expenditure Crowding Out Effect in South Africa. So to just dive right in, we know quite a lot about the effect of tobacco from the health side, the economic side, as well as at the household level. I'll focus just a little bit on the household level. We know that at the household level, tobacco use has been linked to increases in poverty, reductions in nutrition, as well as reductions in education outcomes. And this is an important area that part of the backstory is really the story that we know about tobacco taxes, which is the fact that increases in tobacco taxes that lead to increases in tobacco prices end up reducing the consumption of tobacco products. And this is sort of split between reductions in the number of cigarettes that are smoked, as well as the number of smokers that are using the products. What we want to find out from this particular research is this question about the effect of household level expenditures. So what we call the crowding out effect, right? Which is basically this phenomenon where if somebody spends on tobacco products, then they're not able to spend on other household goods and services that they might need. And that's referred to as the crowding out effect. And so the question that we're trying to answer out of this is, as a result of tobacco expenditures, do we see specific categories that are affected? And is this consistent over time, and particularly in an environment where taxes are increasing? So to answer this question, I turned to South Africa, and during the period that I've highlighted here, which is basically between 1995 and about 2010, we see that South Africa implemented very stringent excise tax increases. So the blue bars here show what effect that had, which is the price increases of cigarettes over that period. But we also see that there are quite a lot of decreases. There's quite a lot, a very substantial decrease in consumption shown by this orange graph going down. So over this period, we had about 4 surveys that took place, and these surveys are able to tell us quite a bit about what was going on at the household level in terms of expenditures. The 4 surveys are basically South African income and expenditure surveys, and these surveys are nationally representative. They basically tell quite a bit of a story about what's going on in terms of expenditures and income at the household level for each of the years when the surveys were taking place. And as you can see, these were surveys that took place over that period I just highlighted. So to answer this question, I basically analyze the data cross-sectionally. I start by defining, 12 standard categories that every household would generally, have. And then I kind of analyze them from, using different techniques from simple to a bit more complex, and try and answer this question about, which categories are most affected and how they're affected and if this is consistent over time. And I'll just take a very short snapshot of some of the key sort of areas that were affected. On the food side, this wasn't really one of the areas that was most affected in terms of crowding out necessarily, but it's quite interesting what we see in terms of the level of displacement of expenditures on food, particularly amongst the poor. And what we see here, the T1 represents the lowest income group, T2 would be the middle, and then T3 would obviously be the wealthiest income group. Each of the different bars here represents a different survey year. And what we see is that these bars here basically represent the level of displacement. In other words, if a household is experiencing or reports tobacco expenditure, how much food, how much of the share of food is affected by that. And this is what this says basically. So what's the difference between those that spend on tobacco and those that do not? And this is what we're looking at here. And so what we're seeing is that over time, there was first an increase, so this longer bar in the middle section here, this orange longer bar, it means there's a higher level of displacement. And then of course the smaller bars mean there's less displacement. And we can see over time this actually changed, and those less displacement of food expenditures over time. In fact, for the second tier, we actually see that there was a flip. So where there was displacement, there's suddenly a crowding in. And crowding in basically means it's the opposite of crowding out, which is taking away. And so in this case, it's actually bringing in or increasing the outlay of food. On education, we also see that there was initially a bump up, but then it starts to decrease over time, and it's consistent across all the different income groups. In other words, over time, what we're seeing is that the level of displacement on education expenditure, or the share of expenditure on education is actually decreased, level of displacement of that share is decreasing over time, which is a positive result. Some of the negative side has been on transport. So on the transport expenditure, what we're seeing is that there was actually an increase over time consistently across all the different tier groups. And so, as taxes were increasing, the level of expenditure or the level of displacement of the share of expenditure on transport was increasing over time. On alcohol, what we saw is pretty much the opposite, which is that the share of expenditure on alcohol was increasing over time. You could think of alcohol and tobacco pretty much the way you might think of sugar and tea, right? If you increase your expenditures on tea, you might quite reasonably expect to increase your expenditures on sugar as well, because the two tend to go quite close together, right? And this is quite a similar story with alcohol and tobacco. And so increases in the outlay on tobacco mean that you are likely to see an increase in expenditures on alcohol as well. And that as well comes with its own sort of negative connotations over time in different sectors of society. So just as a take home, basically what we're seeing out of the data was that households have basically experienced crowding out on several categories, including education, transport, housing, communication, health, and household goods. This was not consistent with all of these expenditures over time, but you'd have some that are in 1 year and drop off another year and so on. There are also a couple of mixed results as I've presented in the previous section. So some of the share of expenditures on food and education, the displacement of those expenditures was reducing over time, which is a positive. But then the share of expenditures on alcohol was increasing over time, and the poor seem to have been most affected by these changes in both instances. So what's the way forward? So in terms of just understanding how do we move forward from here, basically what this story is telling us is that there is the need for I think it's critical to understand the complementarity of the different tobacco control interventions, and one intervention might be able to mitigate the negative effects of another. In this case, what we're proposing is that the government needs to basically consider increasing support to cessation programs to help smokers that continue smoking, even after tobacco tax increases have been effected. And this might be able to help mitigate some of the negative effects that we're seeing from this result, but also maintaining a lot of the positives that we've seen from other studies as well out there. And that's the full story. Thank you very much.
Merci beaucoup, Zunda. Je crois que je vais retenir la toute dernière partie de la présentation, à savoir la complémentarité des interventions de lutte anti-tabac. En effet, la Convention cadre pour la lutte anti-tabac est un tout, et les États devraient pouvoir mettre en œuvre les différentes interventions proposées tant pour adresser les problèmes de l'offre que de la demande, ne pas privilégier juste une intervention au détriment des autres pour ne pas créer plus de problèmes, et les problèmes que pourrait causer la mise en œuvre d'une politique pourraient être jugulés en mettant en œuvre d'autres provisions qui sont dans la Convention. Donc maintenant, je vais rappeler Zunda et Kirsten, que je suis heureuse de voir. Je crois qu'elle a répondu à un commentaire dans la boîte, dans le chat. Très heureuse de la voir avec nous maintenant. As a follow-up to your comment, Kirsten, in the chat box, if some countries would like to try out your model, what should they do? Do you have like practical steps to get in touch with you, and any basic requirements that they should fulfill to be able to try that model?
Thank you for the question. Yeah, so I think the model was designed to be a very practical tool and to be used extensively and to really be helpful to governments. So currently we are still in the process of refining the model. We have at this point applied the model to the South African data, and we are testing it on our own data, and very shortly we'll be submitting it for publication. And then it will then be available to be used. So in terms of countries that would like to use the model, I would suggest being in contact with REAP. At the moment, this model is based off a very similar model that we do as part of our role as the FCTC Knowledge Hub on tobacco taxation. And we use this model, or at least a very similar version of it, to help governments understand the benefits of increasing excise taxes. And we have a platform on our website for you to apply to get support from us to use that version of the model. So I'm sure you could reach out to us through REAP or through the Knowledge Hub, and we'd be able to support you in that way by applying on the Knowledge Hub website. So I'll drop a link to that. We'll probably have a similar sort of platform once this track and trace model is formalized and once it's ready to be used by countries, but we'll probably have a similar sort of process to that. But please do be in touch with us. and we can give you a good outline of the data that's needed. So I did touch on it in my presentation. We need things like what is the current cigarette market structure look like in your country? What is an estimate of the illicit trade? That's quite an important one. And those are the inputs that we need to apply it to your country context. Thank you. I actually see my colleague Zunda is busy dropping those links into the chat at the moment. So you can take a look there and you can reach out to us. We'd be very happy to talk to you about applying the model in your country.
Thank you so much, Kirsten. Zunda, I know you were very strict on time, and 7 minutes is like a very short time to present like all the aspects of your research. Do you have any other aspect that you would like to emphasize now or to talk more about? I know usually when we talk about increasing tax on tobacco products, some people, they think that it's not fair for the poor people to be taking on the burden of increasing the increase on tax, increasing tax on tobacco products. So any aspect that you would like to emphasize more now or to talk more about so that we can get more about this? I think it's a very important issue when we think about people using tobacco and how this can have like an impact on their household and their life in general.
Yes, thank you very much, Susie. That's a loaded question. Look, there's quite a lot to be said about, making sure that the effects of tobacco taxation are not only fully understood, both from this perspective of who's affected by the burden of the tax, but also, for those that actually remain as smokers, what exactly happens to them? I think that's one area that I thought was not quite, clearly understood from my reading of a lot of the literature. I mean, we understand, when taxes are increased, the prices go up. Once prices go up, then, consumption goes down. And that consumption is really driven, as I said in the first part of my presentation, it's driven by the fact that you're reducing, on the first side, you're reducing the number of smokers that are consuming the product, but you're also reducing how much is actually consumed. And what we know from the literature is that, in general, the people that drop off in terms of consuming the product are those that are actually less well off, right? So the people that are the poorer in society, as well as the youth in society, are the ones that tend to sort of drop off amongst those that stop smoking. So already you can see there's sort of an equitable sort of distribution of the impact in that sense, right? Because you're reducing on the most vulnerable parts of your society in terms of exposure to the product. So that's a positive, even though some people still remain as smokers. So my research was really just trying to unpack the part that I thought was a little bit of a black box in trying to understand what exactly goes on there, right? And I think what we're seeing, at least from these preliminary results that are presented, is the fact that there are some positive elements to be taken out of it. For instance, in some cases, some households were basically finding themselves with reductions in displacement of certain expenditure share categories, the ones that presented their foods specifically, and education. But then there are also issues arising, right? So alcohol seems to be coming up quite a bit in the discussion, and what we're seeing is that there may be some need, I think, in the future to sort of start to think carefully about how we craft policies both for alcohol and tobacco, and how the two might be able to better speak to each other in terms of the impacts in a broader sense. So there's quite a lot, I think, to sort of investigate in that respect. And I think, as Kirsten mentioned as well, REAP is not just delving in tobacco control alone, but we're also looking at broader context of NCDs as well. What happens with alcohol control? How can we help out with SSBs as well, and these sorts of things. So there's quite a lot, I think, that can be taken just from the results that I've presented so far. It's as you said, a very small snapshot of what I've done so far. There's still quite a lot to get through. But I think for what we've done so far with this research, I think there's already quite a lot we can learn. and quite a lot that we can already present with you know, various institutions, policymakers, and others that are interested in this type of research. So I'll end there for now. Otherwise, I'll go on and this won't stop.
Thank you very much, Zunda. I think, guys, we have like a good news. We still have like, I think maybe 6 minutes. Then I think I will ask Dr. Arti and Dr. Munga also to come back on board so that we can have like a final words from each of you. And we'll just ask you what is the key takeaway message from your presentation, or if you want to address this question, you can also do what could be like a winning strategy in dealing with illicit trade of tobacco products in Africa. You can either respond to this question or just give us like one key takeaway message from your presentation. I will start with Kirsten while waiting for Dr. Arti and Dr. Munga if they're still online to come back and respond also to the question. Kirsten?
Thank you very much. Okay, so I'll give a bit of both. So I would say that illicit trade it's an important issue that I think we need to talk about, because it's something that the tobacco industry likes to talk about and likes to bring up. And so I think it's something we want to be prepared for. We want to be prepared to respond and to have as much information as we can. And as we know, the ITP does put forward track and trace as an important remedy to illicit trade. And so I think to be prepared for having some practical data on, or at least unbiased data, industry, not data on illicit trade that isn't provided for by the tobacco industry. Sorry, I'm losing track of my words a bit there. That's very helpful. It's a very important tool for governments to understand. And yeah, so I think to use practical tools, I hope ours would be one that's helpful in combating illicit trade, and also helping governments to put together policies, as Zunda said, that it's not just one side, it's not just the tax side on tobacco, it's also thinking about the alcohol, it's also thinking about how do we enforce at the same time to make sure that taxes are paid and that illicit trade doesn't become a major problem and not a major driver to how we are putting together policy. Yeah, so I think those are my closing thoughts. Thank you.
Thank you, Kirsten. Dr. Munga?
Yeah, so what I may say about just a major takeaway here for the study that we did is the issue of illicit financial flows in the context of tobacco is still a big problem. And we don't seem to see much more research as we should in that area. And every aspect of it, whether it is transfer mispricing or base erosion and profit shifting, we will need more evidence from research. That is a major takeaway. Then I also noticed that among the state, there's 4 case study we looked at. There are very rudimentary issues that still need to be addressed, like even simple things like regulations in those countries, that those countries can quickly, and policies that those countries can quickly implement to sort of try to limit the problems that we are facing. I think that is what I could say.
Okay, thank you so much, Dr. Munga, and we will end with Zunda.
Okay, so I've spoken a lot, so I'll try and keep it brief. I mean, so for me, I think the takeaway from my research is that the different tobacco control interventions actually have, they play a bigger role in complementing the effects of each other. What I'm picking up here is the fact that you know, there's a slight negative aspect on the taxation that I picked up. I think I showed that from the result, but that's something that can easily be mitigated by something else, some other intervention that is already part of the repertoire of tobacco interventions that we have. So just understanding that there's the complementarities that exist and making sure that we take advantage of those as we try and implement the FCTC in our different country contexts. So that's on my take home. In terms of illicit trade, I think generally I feel like Africa is sort of already on the right track. I mean, the fact that a lot of African countries are already party to the ITP is a testament to the fact that people understand there's an issue and that it can be addressed quite effectively by something that is already in place, right? With methods that are proven and tested and are fully understood. So as long as countries begin to sign on to the ITP even more and begin to take what is contained in the ITP and domesticating those according to what Dr. Munga said, which is basically creating the necessary policies, the necessary legal frameworks, and so on. I think we can definitely move forward with fighting the scourge very easily. Thank you.
Thank you very much, Zunda. That was very short. Mesdames et messieurs, nous sommes arrivés au terme de cette session. Je vous remercie tous d'avoir été des nôtres et d'avoir pris part à cette session très enrichissante. Nous vous invitons à prendre votre pause et à nous rejoindre tout à l'heure pour la cérémonie de clôture. Nous vous remercions beaucoup et à très bientôt. Bye.